life. This exact mechanical imbalance, where your top number shoots into the clouds while your bottom number stays perfectly normal or even drops, has a specific clinical name: isolated systolic hypertension. It is the single most common form of high blood pressure in individuals over 60, and it is also the most dangerous illusion in modern medicine. Every week in my practice, I see patients who look at a reading like 155/74 and say, "Dr. Cooper, look at that bottom number. It's fantastic. I'm completely safe." They feel entirely healthy. They don't have headaches. They don't feel dizzy, and they aren't short of breath. But beneath that calm surface, their internal organs are taking a catastrophic beating. To understand the sheer magnitude of this threat, we have to look at what this massive pressure gap actually does to your body. The difference between your systolic and diastolic numbers is called your pulse pressure. A wide pulse pressure is a direct, undeniable measure of advanced arterial stiffness. When your systolic pressure is running high, it means that every single time your heart beats, roughly 100,000 times a day, a high-velocity, high-pressure shock wave is shot directly out of your heart and slammed into your vascular network. The primary target of this relentless mechanical pounding is your brain. Your brain is the most highly vascularized, pressure-sensitive organ in your entire body. It relies on a continuous, perfectly modulated microcirculation system. Billions of delicate neurons are fed by tiny capillary beds, some of which are so narrow that blood cells must line up in single file just to pass through them. These microscopic vessels are designed to receive a gentle, steady stream of blood. They are absolutely not equipped to handle a continuous high-pressure hammer striking them tens of thousands of times a day. When your systolic pressure sits at 150, 160, or higher, those tiny, delicate vessels in the brain begin to undergo structural failure. To survive the constant pounding, the walls of these microvessels thickens and narrow in a process called microvascular remodeling. Over time, some of these tiny tubes develop microscopic tears, leading to microbleeds. Others become so narrow that they simply close off entirely. When they close, small localized clusters of brain tissue are instantly starved of oxygen and quietly die. You do not feel this happening. There is no sudden pain, no facial drooping, and no loss of speech. It is a completely silent, invisible erosion of your neural architecture. This is the origin of what we call vascular dementia. What should trouble everyone watching this is that the early stages of vascular dementia, the subtle memory lapses, the sudden confusion, the mild personality changes, this is just one piece of a much larger puzzle. To watch the full, comprehensive deep dive where we unpack this entire topic step by step, make sure to visit my channel. Until then, remember that your health is your greatest asset. Take absolute care of it, and I will see you in the next video.